Hi everybody, I am Dr. Vipin Kumar Pathak, Head of Department and Senior Consultant at Department of Radiology, Apollo Hospital, Navi, Mumbai. Today I am going to speak about a very important organ in our body, which is thyroid gland. What is thyroid gland? Thyroid gland is an endocrine gland. So the next question is, what is endocrine gland? Endocrine gland is a complex system of organs and gland in our body which secretes important chemical called hormones, which are released in our body and are very important for the normal metabolism. The various part of endocrine system is pituitary gland in our brain, then pancreas, adrenal, testes, ovary and thyroid. All this endocrine gland secretes hormones. So let's talk about thyroid in detail. Thyroid is a butterfly shaped gland that is located here in the anterior part of our neck. It has two lobes, one right lobe, second left lobe, and these two lobes are connected by a bar called isthmus. And this thyroid gland is wrapped around our windpipe, which is called trachea. Now, like other endocrine glands, our thyroid gland secretes some important hormones like T3, T4 and calcitonin. All these three hormones are very important for the normal functioning of our body. Now, we have to understand what abnormality we can have if there is some malfunctioning of thyroid gland. Let's understand in a very simple language, not in tough medical language. The first condition is hyperfunctioning of the thyroid gland. As the name suggests, there is hyperfunctioning, means the thyroid gland is secreting more hormone than what is needed for our body, and the condition is medically called hyperthyroidism. The opposite condition is the gland is producing less hormone than what is needed by our body, and that is called hypo, means less functioning, hypothyroidism. So there are two conditions, hyperthyroidism, more production of hormone, hypothyroidism, less production of hormone, and both the conditions are abnormal and needs to be treated. The third condition is called Guaitre. Guaitre, this is the common word, you must have heard about that. Guaitre in simple layman language is the enlargement of our thyroid gland. You must have come across many patients with large gland in the anterior part of neck. That is the enlargement of thyroid gland called Guaitre. Why it happens? It has many reasons. For example, hyperfunctioning and hypofunctioning of thyroid can lead to goiter that I have explained you just now, or it can occur in patient who lives in mountain areas where there is deficiency of iodine in salt, and then that deficiency of iodine can also cause goiter. Then this other condition like some medication used in mental illness like lithium can also cause goiter. So I have told you that hyperfunctioning is abnormal condition, hypofunctioning is the abnormal condition, and third is goiter where there is enlargement of gland. In addition to these three conditions, there are other structural abnormalities that we can only find it by radiological investigation. That is, we can find it only by doing ultrasound, CT scan or MRI. What are those lesions? These are the structural lesions which cannot be picked by the blood investigation, or they are not visible externally. There is no visible swelling and the blood report of T3, T4 are normal. What are those conditions? Those are the diseases like simple cyst. What is cyst? Cyst is a simple lesion where there is a well-defined lesion in the gland which are benign but which cannot be discovered by blood test or they are not visible externally. Then there can be infection, which we call thyroiditis, and there is another condition that is cancerous lesion, malignant lesion that can be picked by this radiological investigation. So these conditions can be picked by simple sonography. CT scan, MRI we can pick, but ultrasound is the best method to diagnose all these conditions which cannot be picked by blood test or they are not visible externally. We need radiological investigation. So, with all these ideas in my mind, I have come up with a concept called Thyroid Screening Program, which we are going to do in our Apollo Hospital, Navi, Mumbai in next month. In this program, what we are going to do, we are going to take your blood sample for T3 and T4 and the expert radiologists under my supervision will do the sonography. So you will be provided T3, T4 blood test and sonography of thyroid gland. And by combining this blood test and sonography, we will be able to rule out any major disease in your thyroid gland. And believe me, if any disease is picked in this screening program, we will take utmost care to get it treated in our hospital on the priority basis. There are a lot of screening programs for breast, for heart, for abdomen, but no one has thought about this thyroid screening program. I came up with this idea because this is a very superficial organ, the disease is common, but no one has thought about its screening program. So I request all of you to avail this opportunity and come to our hospital and participate in this program. We have put a very reasonable cost to this program that will come up in our communication to all of you. So please come to our hospital to avail this opportunity. Thank you.